is that it looks like it gives you central corneal thickness, CD, so that's just the density, cell density. So as you know, the approximately the normal 2,500, 2,700, that would be normal, and it could reduce, of course, post cataract surgery, or that, but it of course bounces back, and which I'll talk about shortly as well. So again, looking at within the software, within the image, that gives you raw image. Again, fully automated. But you can also choose it to be semi-automated method or fully manual method as well. Now, where do we use these for all these tools that are at your disposal? So this is so these are, for examples, these are the images from slit scanning confocal microscope. So I'm going to talk about certain conditions, dystrophies. What are these specifically? That's beyond the scope of this almost 1 hour lecture. So I'll briefly mention what each of these are. But if you want to know more about each of them, I'm sure there are some of them already have had OOLS lecture on the topic. But yeah, I can answer those questions at the end if you like, briefly. So on A, we've got epithelial basement membrane dystrophy, as the name suggests. It's epithelial dystrophy. You can see it's hard to see the epithelial layers there. So you can see a sharp edge abnormality and so in B, abnormal nerves, you can clearly see that they're much reduced numbers, and also they're quite tortuous. C, you've got early keratoconus, where is activation of anterior-most layer of stroma. As you can see in high reflectivity and keratocyte nuclei and hazy extracellular matrix, you can see. So again, that will become more clear when you do laser scanning microscopy, which I'll show examples of as well. D, you've got clumps of brightly reflected, so these dots and these microdot deposits in posterior-most layer of stroma, and that's fleck dystrophy. Fourth dystrophy is actually quite a common one, again, most common one. So you can see microbullae in basal epithelium, and then endothelial guttata and endothelial cell layer. You can see these dots. Keratoconus, as I was mentioning in that one, you saw those stroma layers. Couldn't see the nerves, but here what the nerves look like. You can see they are much more tortuous and potentially reduced in numbers as well. That's really important. So remember, I talked about those nerve maps. It seemed like a lot of work. So that's how these can be traced. This is one of my favorites, one of my colleagues. The central nerves are parallel, and then you have the inferior central, that vortex region where all the nerves come together. In keratoconus, as you can see, if you look central cornea, that's extremely tortuous, and it's almost forming this pattern at base of the cone, at base of the keratoconus. So when you do the map, so that those were the tracings, and these are the actual maps. So if you look at these nerves, the nerves are sitting just right there at the base of the cone. Most of you will be more familiar with this topographical images. So what will you superimpose with these nerve maps? You can see, so that was the one I showed you before. You can see, again, at base of the cone, things start, they're forming a pattern. Again, these are different types of keratoconus.